Hey there, I'm Mark Fennell, and how well do you sleep? Tonight on Insight, Dr. Michael Mosley on how to hack your sleep and get a better night's rest.
So I followed all the conventional advice and none of it made any difference at all. Bang, 3 o'clock in the morning, I was there wide awake again.
There was a stage where I was going to the gym in the middle of the night.
The idea of spending less time asleep to treat sleep deprivation seemed completely backwards to me.
Of all the things I've ever tried in my life, it was the most profound change.
There are so many things which work, which unfortunately are being ignored at the moment.
My name is Otto. I've been struggling with insomnia in one way or another probably for about 4 years, 5 years. On a bad night, I'd have no problem getting to sleep. 9 o'clock, 9:30, I'd be out cold, but then within a couple of hours, 12:30, 1:30, 2, 3, 4 a.m., whatever, wake up, and then my mind would just be racing. When I was really sleepless, I'd worry that I wouldn't be able to perform at work, and that just made the stress worse. Like, I've gotten up at like 3 o'clock in the morning and I'll be on the bike at 3:30 and then, ride till 8 o'clock in the morning or something, or I'll commute to work or get to work really early and start work at 6:30. Initially, I felt really productive. I felt like I was getting so much done because I could be at work early and, nobody disturbs you at 6:30 in the morning when you're at your desk. But it wasn't until the sleeplessness started being accompanied with actually getting physically sick, and I started realizing that, hey, this is a problem. It was a pretty manic state that I was in, and it was all at the expense of sleep getting ever shrunk down into smaller and smaller amounts of sleep.
Otto, thank you for joining us. You're my solo guest today, I appreciate it.
My pleasure.
So, when it was bad, how many hours of sleep were you getting?
At its worst, probably maybe 3-4 hours a night.
Right, and how many times a week was that happening?
Pretty regularly, 2-3 times a week.
Okay, now you work in senior management at a technology company. On the face of it, I would imagine that is a job that has a bit of pressure involved in it?
Yeah, there's definitely stress. It's not that there's anybody at the company who really pushes me that hard. It's more the pressure that I put on myself and the expectations I hire, because you're working with a bunch of really talented people. But yeah, it's fast-paced. It's like holding onto a rocket ship as the company grows.
And when you're at this point where you're feeling like you're not sleeping at your best, do you think that pressure was magnified by having a job where there is actually quite a fair amount of pressure on you?
Yeah, absolutely. I was concerned that if I wasn't getting the right amount of sleep, that my performance was going to be subpar, and would feel like, hey, I'm going to miss something, and then eventually I would think, hey, I'm going to get fired, I'll lose my job, I won't be able to pay my mortgage. Rapidly, I would catastrophize about that.
When would you say it was at its worst?
Probably about 2017, 2018.
You've got small kids as well, right?
Yeah, I have. Jossie's almost 4 and Nina is 7.
And do you think your sleeplessness was having an effect on them as well?
Definitely, I felt less connection with them because on the weekends I would just actually have to go lie down and have a nap. I was that exhausted. It was physically painful almost for me to be playing with them because I was that tired. So, 11 o'clock in the morning, I'd go lie down, have a nap and try to recharge a little bit and be out for 2 or 3 hours. And I felt like I was failing them because I wasn't there for them.
But now, Zoe, you've got a young family. When did you notice your sleep patterns change?
After I gave birth, sleep patterns definitely changed because I had a baby who was relying on me to wake up every few hours to feed him. But I was really lucky, and at 6 weeks he started sleeping through, but my sleep patterns stayed at that waking up every few hours or not being able to fall asleep.
Wait, so your child was sleeping through, but you couldn't sleep anymore? That's just cruel.
Yeah, yeah, it is.
So tell me what happens when you do try to go to sleep then?
I literally just lay there and toss and turn. If I can't go to sleep, I might get up and do some study, or I'll try and read something to try and calm down a little bit.
How many hours would you say you were getting when it was bad?
3-4 hours max.
Okay, so how are you navigating being a new mum on those hours?
Very difficultly. But something kind of kicks in your head, and you put that mum hat on first before anything else, and you don't really worry about it until he's gone to bed and he's asleep, and you go, oh my gosh, I'm exhausted.
And yet there was a moment when it sort of came to a head, right?
Yeah, absolutely. It got to a point where my family started noticing, like family that's not even living with me and who don't even get to see me that often. They could pick it up just through the way that I was messaging or the way I was on the phone. And then obviously my partner who lives with me, he was copping the brunt of it because I'd get snappy. I'd be really just moody and up and down with everything. And he kind of said, hey, what's going on? And that was kind of when I realised, like, oh, okay, like this is actually really affecting me now.
We're joined also by Dr. Michael Mosley in London here. Doctor, you've said that you're obsessed with sleep. Why is that?
Because sleep is one of the most important things in our lives. When you aren't getting enough sleep, then everything else feels terrible. It makes you feel really stressed, which means you're going to sleep worse. One bad night's sleep is bad for you, but when you have a run of them, it's terrible. And also that horrible feeling that it's never going to get better.
This is quite personal, though, for you, isn't it, Michael?
Oh, 100%. Because I went through a similar burst for similar sort of reasons when I was in my 40s and 50s. And the trouble is you kind of almost get into the habit of waking up at 3 and you're thinking about stuff. I was at a conference recently and I said, who wakes up at 3 in the morning? And about 3/4 of the audience stuck their hands up.
Were you always a bad sleeper?
No, when I was young, I could sleep absolutely anywhere. I used to travel a lot. I remember sleeping in a graveyard once. I slept in a telephone kiosk back in the days when they had telephone kiosks. You know, I was legendary. I slept in a bath at a party once and had to be woken up the next morning. It was only when I started to have kids and I had a more high-pressured job that my sleep went kaput.
Okay, I want to do a whole special on the time you fell asleep in a cemetery, but when it wasn't working for you, could you describe what your sleep process was like, the things you did to get to sleep?
Sure, so I followed all the conventional advice. I tried changing the pillows, the mattresses. I used to go and exercise regularly, and exercise is a very good thing. But unfortunately, if you've got a pretty bad insomnia, it's not going to be enough. I tried all sorts of aromatherapy, scents, things like that, and none of it made any difference at all. Bang, 3 o'clock in the morning, I was there wide awake again.
Now, Michael, you've just written a book about sleep, and I think a lot of conversations about sleep do come down to the number. How many hours of sleep did you get? How important actually is that number?
Probably not as important as people think, because we have huge individual variability in terms of how much sleep we need. Certainly, for example, throughout life, your sleep needs change. So when you're young or a teenager, you need a lot more sleep than when you're an adult. And that actually the most important thing is what you call sleep efficiency. And then there are other very important components of sleep, which include things like deep sleep and also REM sleep. So there's lots going on in sleep. It's a really complicated story.
So on that point of sleep efficiency, this is what that actually looks like. So we actually sleep in these 90-minute cycles that involve different stages. You've got your light sleep, your deep sleep, your REM sleep, which is, of course, where your eyes move rapidly. How well you sleep is measured by efficiency, which is the time you spent in bed compared to the time you were actually asleep. Now, the Insight team, they needed a guinea pig, so they got me to measure my sleep on a Friday, and this is how that went down. So I went to bed at around 2 o'clock in the morning. Please don't judge me. I then entered deep sleep within half an hour. I then had a period of light sleep, and then there were some solid blocks of REM before waking up in the early hours of the morning. Now, just in terms of the difference between those types of sleep, Michael, what is the difference?
Sure, different things happen at different stages. So in deep sleep, you produce a lot of growth hormone, particularly for younger kids, that's important. During deep sleep, you also move your memories from short-term into long-term. And in rapid eye movement sleep, REM sleep, that seems to be particularly important for your emotions. That's when you do your most vivid dreaming. And those vivid dreams, in turn, seem to be important for sort of, helping you process emotions. And again, at this time of year, with all these things happening, it's very important that we're able to, process our emotions and handle all the pressures which are going on. And these two components are really, really important.
So for my night, I lay in bed for around 5 hours, but it was only actually sleep for 4 of those hours, meaning my sleep efficiency is 86%, which personally I'm counting as a win. However, we also made Michael Mosley do this on the same Friday, and if you look at his graph, he went to bed much earlier and he slept a lot longer, a total of 7 hours, but he woke up early in the night. Actually, Michael, why did you wake up so early in the night?
I blame my kids. So I've got 2 of my kids at home at the moment because of COVID-19, and they decided to have an online party at about midnight with their friends. So there was a lot of whooping and hollering and things like that. So that was me waking up and going downstairs and shouting at them.
Great. All right, so if we look at Michael's sleep breakdown, you can see that he had less REM, but more light sleep. But generally speaking, if you look at the 2 graphs next to each other, our sleep efficiency was around the same. So is there an efficiency we should be aiming for? And Michael, not that I'm competitive or anything, but I see 1% difference between the 2 of us. Did I win sleep?
You're right that efficiency matters. The other things matter as well. It really depends on when you woke up, how you felt. That one of the most important signs of whether you're getting enough sleep is, do you wake up feeling refreshed? And more particularly, do you fall asleep in the afternoon? If you fall asleep very rapidly, certainly within 10 minutes, that would suggest you're seriously sleep deprived. We all have different needs. Maybe you're a particular sort of sleep mutant who can get by on less.
I'm going to add that to my bios. Michael Mosley called me a sleep mutant. But specifically with that efficiency rating, is there something I should be aiming for? Like, should there be a target?
Ideally, you want to be 80% or more. When you're a teenager, you're probably hitting something like 90%. Sleep quality tends to deteriorate as we get older. Less than 80% ain't great, because it suggests you're waking up a lot during the night, and that is going to be adding to your stress.
I'm definitely counting 86% as a win. Now, I want to bring in Anna here. Anna, you've had sleep problems for decades, but what changed in your 40s?
Up until I was 40, I could go for a night without any sleep. But once I hit 40 and I'd had a really sleepless night, I was just bombed. And that made it very hard. The work I was doing at the time was a bit different, and I couldn't kind of fake it internally during the day to make it.
And what was the impact on that, on your personality, on your day-to-day?
It was really hard. I had a fairly high-pressure job. I was working in legal policy for an attorney, trying to read what is often very boring stuff, and made me feel like I kind of had lost IQ points. It'd feel murky. I couldn't kind of get to the answers I needed at the time. So yeah, it definitely made me feel kind of dull rather than shiny.
And so what was your nighttime ritual like in those immediate hours before bed?
Look, probably not that fabulous, to be honest. I'm sort of someone who tends to go to bed a bit late, but when I was trying to get to sleep, it's kind of counterproductive to try and get to sleep because you'd sort of wind yourself up. A friend once described it as, they sent me a cartoon that said 3 voices in my head are saying go to sleep, but the 4th one is saying, do penguins have knees? So like when I try to go to sleep, all sorts of things come into my head and I kind of follow them and kind of think, oh, I wonder what was the answer to that and things. So yeah, just a very busy brain at the best of times.
As I understand it, things changed for you when you started to go through menopause. What happened?
It got a lot worse. It's a lot more sleepless nights. And again, I was in a very sort of high-stress job, which I actually really enjoyed. But the combination of menopause and lack of sleep, there were times when I kind of would lose words and things.
You are not lacking in personality. I'm curious, did the lack of sleep change your personality?
Yeah, when I'm really in a bad spot, I can get a bit snappy, I can get a bit short, I lose my sense of humour. you're not operating from that, best side of yourself.
But for you, Otto, you actually got quite sick when it was bad, I understand.
Yeah, there was a period of time where I just could not get well. Like, I would be sick and I'd have sinus infections, and then I would get to 80%, 90% well, and then I would just go downhill for a whole week and I'd be out for a week. But
And were you cognizant of the fact that it was connected to your lack of sleep?
I thought at first it could be the fact that I was travelling too much, but then I really think it was mainly the connection with the amount of sleep that I was getting, and then making that connection makes the problem worse, because now I'm chasing the sleep even harder than I was in the first place, which is the opposite of what I should really be doing if I'm trying to get sleep.
Hey, Dr. Michael Mosley, hearing these stories, what's going on inside our body when we don't get enough sleep?
All sorts of complicated things are going on in the mind and also in the body. We did an experiment a while ago where we deprived a group of volunteers of sleep, and one of the things we saw there was their blood sugar levels soared, and so your ability to control your blood sugars is decreased by lack of sleep. And the other thing that happens is you get super hungry, and so you crave all these sort of particularly carby, sugary things, and then you eat more of those, you put on weight, you snore more, you sleep worse. And in your brain, people are just describing all the sort of horrible fog which goes on, and that is very typical of sleep deprivation, unfortunately, because there is actually a cleaning process that goes on in your brain at night. There's a system that wasn't known about 10 years ago called the glymphatic system, and it literally is the case. There are channels in your brain that open up and fluid rushes through them, cerebrospinal fluid, and your brain literally gets brainwashed during the night. And if you're not getting enough deep sleep, process does not occur, and you get the accumulation of some of these proteins, and people think that ultimately leads to things like dementia and Alzheimer's. So that's a pretty profound effect that lack of sleep has on the brain, particularly, as I said, deep sleep.
What about its impact on our immunity? Is there a relationship there?
A very profound one, and that again is quite a recent finding, because it's in deep sleep that your body produces a lot of the elements which are important to the immune system, including cytokines and antibodies. And there was a really interesting study done a few years ago in the States where they took around 160 volunteers and they got them to wear an activity monitor so they could look at their sleep, and then they brought them into a sleep lab, and they actually squirted common cold viruses up their noses, and then they kept them in a hotel nearby for a couple of weeks. And what they found was that the people who were sleeping less than 6 hours a night, they were 4 times more likely to come down with a common cold than the people who were getting 7 hours or more and who were getting good quality sleep. And that suggests just how important the immune system is, how much it's dependent on sleep.
Just out of curiosity, Michael, most of us are in some form of self-isolation at the moment. How are you sleeping with COVID-19 milling around?
Well, it's very odd, isn't it? Because it partly feels like you're in the middle of some awful science fiction film. I mean, this is being filmed in my back garden at the moment. And I'm actually sleeping all right, because I've taken the advice I gave in the book, and that seems to work. I've kind of broken the cycle. And I stick to a very regular sleep routine. I do my exercise. I'm eating a diet which is sort of rich in Mediterranean foods and also fermented foods. So I'm actually getting a reasonable night's sleep at the moment. I guess I'm pretty lucky like that. But I can absolutely identify, because there are an awful lot of people out there who are having a tough time at the moment.
They are allowed to fall asleep, and when they fall asleep, we wake them back up again. So basically, we maintain a sleep deprivation across the whole night.
I was so exhausted. It was cruel and unusual punishment, but it was also amazingly effective.
When does struggling to sleep become a serious issue? Well, the most common sleep disorder is insomnia, which affects around 3 million Australians. It involves trouble falling asleep, staying asleep, or waking up too early. If that happens 3 nights a week and continues for 3 months, and it affects the rest of your life, you could have a chronic problem. And that can impact your health. Poor sleep is linked with increased risk of high blood pressure, heart disease, and diabetes. And research shows insomnia affects your mood and could lead to depression. One study found those with the condition are almost 10 times more likely to be depressed and 17 times more likely to have anxiety than those who sleep normally. So what can you do to treat it? Well, there are a range of options that can help. But of those who see a doctor, data shows 90% leave with prescription medication.
Now, David, you've struggled with your sleep since you were a teenager, but tell me about the moment you decided to turn to medication.
Mark, it was probably after a couple of years of suffering from insomnia, a sleep study that returned no useful results at all, that it became the next option that was talked through by my GP, and we pursued it.
Tell me about that conversation. Why did it feel like it was right at that moment?
It was the next thing to try, if you will. It was seen as a really quick way to treat the insomnia then and there and stop it from becoming a chronic problem.
Quick, but did it work long term?
No, it didn't. And that is what I've come to learn. It's not meant to be a long-term solution. It's only effective and useful in the short term.
How long did you use medication for?
A lot longer than I'd care to admit. And I think that really comes back to, call it perhaps a level of arrogance in thinking that it couldn't possibly anything to do with my mental state. It's clearly going to be physiological and I should be able to treat it with medication.
And when you were on various different forms of medication, did you ever reach a point where you felt like you were dependent on them?
You don't notice that you are dependent upon it, and you probably wouldn't label it as dependence if you were asked. For me, it became just part and parcel of my sleep routine.
Anna, you also tried medication. How was the experience for you?
I've tried some of the natural medications like melatonin. I don't find it works particularly well, and I wake up with a melatonin hangover where you feel like you're in fog for the first couple of hours of the day. Over the years, probably over the last 10 years, I do take temazepam, but really carefully because I'm really scared of addiction.
What about you, Dr. Michael Mosley? When do drugs become part of the solution for you?
I use them occasionally when I am travelling. So for jet lag, I use Zopiclone. And I also take melatonin occasionally. I certainly find it effective. Unlike one of your other guests who gets the hangover, I don't get the hangover at all. I also say to myself before I take it, this will do me good, this will do me good, because I'm a huge believer in the placebo effect. So I suspect that's a strong part of it. But clearly, drugs are not the long-term solution. And yeah, people tend to develop dependency and they also tend to develop tolerance. So the drugs stop working after a while.
Leon Lack, you're a sleep psychologist. What do we know about the way sleep medications affect our body?
Well, they certainly are a sedative. They will decrease activity in the central nervous system. They're an easy solution because they're easy to administer and take. And they can be prescribed in a very short general practitioner consultation. So they're a very alluring remedy to use, and that's one of the difficulties, is that other options often are more demanding of your attention and effort.
When should drugs be prescribed?
There will be some occasions in which a person's under severe stress and their sleep is going to be disrupted by that. And just to manage getting through that stress in the short term, I think it's perfectly reasonable to prescribe a short-term course of benzodiazepines. But even for people that are experiencing a little bit of stress and a little bit of a disruption of their sleep, I think counseling, advice, and cognitive behavior therapy is probably a better way to start than starting with a drug solution.
Otto, for you, what other sorts of things did you try that helped?
I tried melatonin. That made absolutely no difference. Noticed no effects whatsoever. I tried, good sleep practices such as having a filter on my phone and making sure it's off at the right time, and having that away, making sure that the bedroom is all about sleep, having all that set up, and more or less nothing of that worked. And then tried meditation to try to calm the mind. Figured out I was trying way too hard to calm the mind, and that's just totally doing it wrong.
Don't think the mind works that way.
So no, I couldn't really find anything that worked for me.
And Zoe, did you try other things?
Yeah, I did try taking valerian, which is a natural supplement, and I thought I noticed a slight difference, but that was only within the first couple of days. So I don't know whether it was my brain just thinking, yay, you're doing something, like it's going to work.
Michael Mosley, what is the evidence for some of these non-medical approaches like valerian?
And not very good, it has to be said, that most of those things maybe work a little bit in some people. There haven't been a lot of clinical trials, and the one that have been done have not demonstrated anything very impressive. The sleep industry is a multi-billion-dollar industry, and unfortunately a lot of desperate people out there trying a range of stuff. I'm sure there are some people who it works for, and I suspect it's mainly a placebo effect. But it is, as one of your contributors was saying, cognitive behavioral therapy, psychological techniques seems to be very effective. And unfortunately at medical school, they teach you nothing about sleep, almost nothing at all. And that's why so many doctors, so many GPs struggle when they have patients in front of them who have problems with sleep, because they don't kind of know what to offer them.
Zoe, you've tried exercising to help with your sleep. How's that been working out?
There was a stage where I was going to the gym in the middle of the night and I would just get on the treadmill and go for like an hour, or get on the boxing bag and just throw a few punches in to wear myself out. And then I'd come back home and have a shower and be able to fall asleep a little bit quicker than normal.
Otto, has exercise ever helped you with sleep?
When it was really bad, I was training for Ironman, so I would train 15, 16 hours a week and hard. So I would definitely fall asleep. But sure enough, as soon as that seemed to wear off, and I'd wake up, and then the mind would just be ready to chew on whatever it is that was there.
Michael Mosley, is there a way in which exercise can help you get a better night's sleep?
I think so. I mean, there is quite a lot of evidence that people who exercise regularly tend to sleep better. And we also know that if you exercise regularly, it means that you're likely, to reduce a bit of weight. But again, exercise alone is kind of unlikely if you have a serious problem with insomnia to crack that problem.
I suppose if we're talking about exercise, we should probably also talk about diet. I can assume that diet changes the way you sleep?
There is now emerging evidence, and in my book I write quite a lot about it because it is so new and so exciting. The impact of diet on, particularly as I said, if you can switch over to a Mediterranean diet, which is rich in veggies and legumes and oily fish and nuts and things like that, there's a lot of evidence that calms the mind. Some brilliant work being done in Australia on this, particularly Food and Mood Centre in Melbourne, but various other places have shown that switching diet, moving away from a highly processed diet to a more Mediterranean diet, has a profound effect on mood, and in a relatively short period of time. They did a study with about 300 students, and within 3 weeks, the ones who had been randomly allocated to the Mediterranean diet, levels of stress had reduced by almost half, and they were all sleeping better. So what you eat really does have a profound effect on how you feel, and therefore on how you sleep.
David, listening to this, you tried a lot of this stuff too, on top of the medication, didn't you?
All of the lifestyle factors that you can think of, all of the sleep hygiene factors you can think of, whatever it is, you name it, I've probably tried it. Everything except the hard part, the real psychological side of things.
So when was the moment you realised you had to turn to your mind as a solution?
I think it's almost the weight of time, if you will. And you say, I don't think I can keep doing this forever. I don't really want to be like this forever. There's got to be another option.
So over the last 9 weeks, you've been taking part in a program that is specifically designed to look at your behaviour and your mental state around sleep, and this is actually what it looks like.
Our bodies are really, really good at getting us to sleep. It's our minds that tend to keep us awake. Even the simple act of approaching my bedroom and the thought of getting into bed and having to try another night's sleep can cause feelings of anxiety. So a typical night's routine in the lead up to bed might look something like putting the screens away by probably no later than 7 o'clock, and then beginning to do some quiet, relaxing, unwinding, mindful type activities. One of the key ideas behind sleep restriction is to limit the window in which you've got available to sleep. If I'm not feeling sleepy at 11:30, I'll continue to try my pre-bed routine until a point where I do feel tired. Some nights that could be into the early hours of the morning. I find quite a lot of calming in playing piano or meditating, reading a good book, just simple, quiet, relaxing things. The idea of spending less time asleep to treat sleep deprivation seemed completely backwards to me. But when you start to think about it, it does make sense. If I've gotten into bed and I'm feeling sleepy, but I find that within, say, 15 minutes I'm not able to sleep, then what I'll do is I'll get out of bed and I'll leave my bedroom, come out and sit, say, in a quiet space, turn on a dim light and either try the same things I was doing on the way to bed.
Firstly, amazing piano playing. I think that has to be said out front. But functionally speaking, you're basically spending less time in bed.
That's right, and it's a bit strange to think of, right? Insomniacs don't get enough sleep and that's the cause of all their grief, end of story. So the idea there is to remove yourself from that space when you can't sleep. If I feel awake, I won't be in bed. So that you're only spending time in that space when you do feel sleepy is going to promote the ability for you to fall asleep in that area, in that bed, in your bed.
And has there been any improvement?
Pleased to say that yes, there has been. I've noticed that by becoming a little bit more aware of the way that there's this intrinsic link between mental health and anxiety, if you will, and sleep quality and insomnia, it's allowed me to probably place a little bit more importance on adapting that discipline.
Dr. Michael Mosley, that program that David's been going through, that idea of restricting your sleep, how does it actually work?
It's actually a very well-established form of behavioural therapy where what you've got to do is associate bed with sleep and sex and nothing else. Sleep restriction therapy has been known about since the 80s and it is brilliantly effective, but for some strange reason it hasn't got out there. So when I was researching my book, that's what I did. I put myself on a course of sleep restriction therapy and it really did sort out my insomnia. And the reason certainly I discovered is because I go to bed when I'm really sleepy. Sometimes I still wake up in the middle of the night, but I get out of bed. I've got some really dull books, some old economics books left over from some film I made a long time ago. And I read my way slowly through those until I feel really tired and I go back to bed. And so it's really associating and learning that bed is about sleep, as I said, sleep and sex and nothing else.
You're going to get some angry letters from some economists. So how long does it take to see results?
The great thing about sleep restriction therapy is, broadly speaking, it can be a few weeks. It can take 6 to 8 weeks, depending on how serious it is. But the great thing is that compared, for example, to drugs, medication, is it becomes more effective over time. The research shows that if you go through it, then a year later, you'll still be sleeping better, whereas with things like drugs, the effect wears off. And it doesn't work for absolutely everyone. It is quite challenging, but I think it's one of the best tools we have, and it's very underused.
It is challenging, but Leon, you've devised a similar program that takes place in just 24 hours. How does that work?
Well, it basically works on exactly the same principle as the behavioral therapies that have been described very well. But it works more rapidly because we have the experience of falling asleep quickly many, many times during the night, on one night. And the procedure goes this way, that they are allowed to fall asleep, and when they fall asleep, we wake them back up again. They're only allowed to sleep 2 or 3 minutes, and we know that that doesn't satisfy your sleep. So basically, we maintain a sleep deprivation across the whole night. Now, what happens is that initially it might take 20 or 25 minutes to fall asleep on the first attempts, but then gradually people start experiencing falling asleep within 2 or 3 minutes on every occasion that they attempt to fall asleep. And so what happens is that we can get in a lot of trials of falling asleep quickly over just one 12-hour or 24-hour period. And so the next day and the next night of sleep, they find that they can fall asleep much more quickly. So instead of the process taking 4 or 5 weeks to kick in its effectiveness, the process can kick in over just 24 hours.
It also sounds like something that's been banned by the Geneva Convention, that amount of sleep deprivation. Anna, you actually first encountered Leon's work in 2017. Out of curiosity, what was your first reaction?
I was super excited about joining it because I was in a terrible insomnia phase at that point.
And you did it?
I did it. But about the 4th time it had woken me up in this one night, on a Friday night, I was like, oh my God, what have I done? And you got out of bed, and I can remember it was the first time I read a Marion Keyes book, and I'd go out and I'd read for exactly sort of 3 minutes and then go back to bed. I was so exhausted. It was cruel and unusual punishment, but it was also amazingly effective. And then after that, it was like putting my head on the pillow. Was like, oh, I know what to do now. I put my head on the pillow and I go to sleep. Of all the things I've ever tried in my life, it was the most profound change.
And what about long term?
Look, I did it in November 2017 and it was really good, but the following January I got diagnosed with breast cancer, and that threw my sleep into another set of turmoils and things. And the cancer was all fine, it was stage 1, grade 1, but there's still a whole lot of emotional things going on that journey.
Leon, what have been some of the broader results from the program?
Well, like Anna says, that it really is effective, and we had a follow-up to measure its long-term effects, and that was very promising as well. After 6 months, people still showed very significant improvement. Now, I just want to mention that, that what Anna experienced was using a little device at home. And we've developed some new devices as well that can allow the administration of this type of behavioral therapy to be done in the home environment. And might say to Anna, we still have a pilot study running on that if she's interested in participating.
If nothing else, I'm glad we brought you back together again.
I'm in Melbourne, but I'm sure we can work it out.
Michael Mosley, we've talked a lot about sleep restriction, but there is this concept of cognitive behavioural therapy, which is a well-known concept that's been around for decades, but specifically CBT for insomnia. How do those two things interact?
Sure. So sleep restriction is a key part of the cognitive behaviour for insomnia. It's the behavioural element, and the cognitive bit is the bit where you try and sort of deal with and process your negative thoughts by challenging your thoughts. And that actually is surprisingly difficult to do. And to do that, you may well need to see a therapist. It's not an easy thing to do, to treat your thoughts as a rather sort of annoying person who is always putting negative thoughts in your head. And you have to almost treat it like something outside yourself. It can be very effective, but it is a challenging approach.
Otto, you did try cognitive behavioural therapy. How did it affect your sleep?
It was literally life-changing, and it was mainly on the cognitive side. I had a brilliant sleep therapist and worked with her, and my problem was basically that when I woke up, I would start worrying about things and catastrophizing those things, and it was mainly around, if I don't sleep, I will perform poorly. And she said, you know, you realise that these aren't truths, but you won't experience that unless you actually experience it. So in working with her, we were talking about, you know, what examples have you got to prove that this is the case, or that you can use to disprove the case? And I told her a story about when I was in the US and I was presenting in front of 50 people, all in the senior leadership group of my company. And I had just flown in and I had 2 hours sleep, And I was pacing the stage, and I said, I'm not pacing the stage because I'm a great presenter. I'm pacing the stage because I'm trying to stay awake. And then went on to give the presentation. And at the end of it, my CEO came up to me, and he's got a reputation for being a little bit critical of people at the end and giving you lots of really direct advice about your presentation. And he said, Otto, 2 things. I was like, yeah. 1, great job. And I was kind of stopped and what happened here? 2, do you need a sleeping tablet? I was like, yes. And I wasn't going to take any, but and she said to me, you think that you're going to do terrible. Here's an example of you being in the worst possible sleep situation, and you did great, to the point where your CEO gives you a compliment for it. And then I was like, oh crap, okay, yep. And so actually experiencing it is what was for me started to help change the thoughts to a positive pattern rather than a negative pattern.
So how long did it take for it to improve?
From the time where I started seeing my therapist to the time where I was actually had remarkably better scores on the sleep questionnaire, and though my diaries were looking great, was probably about 3 months.
Right, 3 months. So definitely not a quick fix.
No. And she would, I felt like I was wasting my time for a lot of it, where she would explain, here's how it works, here's what we're trying to achieve. It wasn't really until I experienced it for myself that I really actually understood what she was saying. I think there's a lot to be said for that.
Yeah. Michael Mosley, you tried CBT too. What was your experience?
Similar. I actually found, I gave my thoughts a name. I called them Donald. And so every time Donald is whispering stuff into my ear in the middle of the night, I go, shut up, Donald. I don't believe a word you're saying. And I found that a helpful technique, I have to say. But what I discovered is it's the combination of stuff. It was the sleep restriction, it was changing the diet, it was losing weight, it was doing all these things which helped in the end. But Donald still wakes me up occasionally and yabbers away, but I try to ignore him.
Are there particularly egregious sleep myths that you would like to take this opportunity to dispel?
One which is very, very popular is the idea that cheese gives you nightmares. They've actually done a trial on over 100 people, and no link between cheese and nightmares at all.
He pushed me up against a wall and grabbed me by the chest, and then started to abuse me, saying I'm only in it for the money.
It's been about 45 days now without a day off.
What is the bigger challenge for you, the injured animals or the people?
The people.
The owners?
Absolutely.
Michael, are there some simple tips that people watching this right now that they can do right now before they go to bed to have a better night's sleep?
Yes, I would actually also practice breathing techniques. There are some really simple ones which, when you're feeling stressed, are remarkably effective. There's one called 4-2-4, which I'm a fan of. You breathe in through your nose to a count of 4, you hold it for 2, and then you breathe out to your mouth to a count of 4. And you do that for a minute or so, and what that does is it slows down your heart, and it kind of helps you drift off into sleep.
Are there any other rituals you can do before you go to bed?
Yes, I mean, the important things are having a period of time when you relax, listen to music, try not to be overstimulated. Social media, all those things are toxic to sleep. Try to go to bed at the same time, certainly wake up at the same time every morning. Go to bed when you're feeling tired. If you're not feeling tired, then hold off for a bit and find some really boring books, some really boring economics books that you can turn to at 3 in the morning.
What is the best way to tell if you are not getting enough sleep? Is there a simple way of finding that out?
Yes, one of the best techniques is to go to bed in the middle of the afternoon. There is a slightly crazy technique where you get a metal spoon and a metal tray, and you hang your hand over the side of the bed, and you look at the time, and then you close your eyes. And the theory is that when you fall asleep, the metal spoon falls out, hits the tray, clang, wakes you up. You look at your watch and see how long it took you to go to sleep. If it takes less than 10 minutes, that suggests you're seriously sleep deprived. 15 minutes, not great. 20 minutes mean you're probably doing fine. That particular technique was invented by a very famous Chicago sleep researcher, but these days you'd probably find it simpler to set your smartphone to wake you up in 20 minutes' time, go to bed, close your eyes, and do you fall asleep before the phone buzzes at you? And if you do, then that suggests you may not be getting enough sleep.
Are there particularly egregious sleep myths that you would like to take this opportunity to dispel?
I think one of them is the fact that it's all about the blue light, and if you put special filters on your smartphone or your computer, then that means you won't have any problems. It's not really about the blue light, it's about the fact that social media is very stimulating, and that means that whether the light is blue, orange, green or red, that's going to be stimulating your brain at exactly the time when you actually want to go to sleep. The other one, which is very, very popular, is the idea that cheese gives you nightmares. They've actually done studies, a trial on over 100 people, and no link between cheese and nightmares at all.
I'm going to let the cheese one through to the keeper, but Leon, the one about blue light's a bit controversial. What do you make of the blue light assessment?
Well, I think what Michael says, I generally agree with. But blue light late at night of high intensity can have the effect to delay your body clock and your circadian rhythms, they're called. And if you do that every night, it can result in your rhythm drifting to a later time and making it more difficult for you to get to sleep in the evening. So there is a little bit of research sense that would suggest that avoiding blue light, or at least highly intense blue light, late in the evening before you go to bed is probably a good idea. But again, it's one of those sleep hygiene type of recommendations that a person with chronic insomnia is not going to be helped very much by, because the chronic insomnia is really a learned habit pattern over many years.
And for you, Leon, are there egregious misconceptions about sleep that you'd like to put paid to for once and for all?
Yes, I think sort of a general cognitive therapy element, which I talk a lot to my clients about, is the belief that your sleep should be a long, solid process from beginning to end, with no wakenings across the night. What happens is we come into light sleep about every 90 minutes, and at least towards the end of the night, it's very common and very natural to wake up, at least briefly, out of those light sleep phases. So that shouldn't be considered to be pathological or detrimental to you. The issue is recognizing that you've woken up, accepting that as a natural part of the sleep pattern, and then relaxing so that you can learn to fall back to sleep quickly. Being awake for a few minutes, even several times across the night, should not badly affect your next day.
What would you like to see next, Leon, in sleep research?
We know how to treat insomnia very effectively, but we need to get at that into the public. Most individuals, though, with poor sleep or chronic insomnia will go to their medical practitioner for help. And the medical profession is not well placed at present to deal with that. Michael has found out a lot about sleep and would be a perfect sort of professional for helping people with poor sleep, but most medical practitioners don't have that understanding of sleep, that understanding of cognitive behavior therapy. So trying to translate that information into primary care, into general practice, is what our university has been attempting to do.
The reason I wrote the book Fast Asleep was to get this stuff out there, because GPs struggle with all sorts of sleep problems, and there are so many things which work, which unfortunately are being ignored at the moment.
And Zoe, what's next for you in tackling your sleep?
I guess from here, especially in the age of COVID with no gyms, we can't exactly go out and have a run in the middle of the night, and probably not the most effective thing either, really. So I guess from here it would be talking to medical professionals, getting the help of my doctors, looking at psychologist appointments just to help bring some of those thoughts back to a slower level, so that I can actually learn how to switch off at night rather than have 20 million things running through my mind 24/7.
You're studying to be a paramedic. After having heard all of this, how do you feel about the prospect of shift work?
It's awesome. Sounds like my kind of gig. I guess if you have an established sleep pattern, it can be a little bit harder to adapt to, but I find that because my sleep pattern's all over the place, I'm not too worried about it, surprisingly enough.
Michael Mosley, is there anything that you think Zoe should be mindful of as she embarks upon that particular career in shift work?
I think that she needs to establish a good pattern because shift workers notoriously suffer from really big sleep problems. Unfortunately, I've talked to a lot of shift workers and very few of them get any sort of advice. One of my sons is a junior doctor at the moment and he really does know how to organise his life in order to minimise the impact of shift work. He does things like time-restricted eating, which seem to be effective. So if I was Zoe, I really would look into it a bit because it can be a major disruption.
Anna, since you've reset your sleep with that very intense program, how have you been going?
Up and down. But on the positive side, I think because as I've got older, I don't worry about waking so much in the night. And I think that I might have heard that from Leon years ago. And so, because I used to really worry about if I woke up in the night, and that is, for me now, it's just like, oh yeah, I'm awake. I have done a lot of ironing in the middle of the night and trying to combat these things. It's a bit mixed, I think, for me. But I'm certainly inspired to get myself back on track again.
And Otto, for you, how are you sleeping now?
Most nights I'm sleeping pretty well. I think the times when I struggle is just when the work and stress gets to me and I just wake up and find myself thinking about all the things I have to be on top of and planning every possible scenario, etc. So when work stress goes up, then I regress. But generally speaking, when I left my therapist, I was quote-unquote cured and life was pretty much back to normal.
Otto, thank you so much for talking to us, and thank you to all of the people who joined us around the country and around the world. That is all from Insight tonight. I'll be back at 10 o'clock with The Feed. Dateline is up next.